on your hometown station, WISF.
Hi, welcome back to News 15. I'm Cindy Bucci. Thank you for spending part of your evening here with us. I am joined by Dr. Dohner from Oneonta Derm. Thanks for stopping back in to see me.
Thanks for having me.
All right. Why don't we go over some of your credentials, Doc?
Okay. I'm a board-certified phlebologist by the American Board of Phlebology. I was one of the first doctors in New York State to be certified. I've been treating varicose veins for the past several years. I've performed over 1,000 varicose vein surgeries and endovenous laser ablation at my office at the Skin and Vein Center here in Oneonta. We perform a lot of sclerotherapy, not only for cosmetic veins, but also for true varicose vein.
And what are we going to be looking at here, Doc? And I do just want to let you know some of these photos are pretty graphic.
Some of them.
A few of them are.
And some of the photos that you're going to see, and I think we have about 5 of them, are typical varicose veins, but then other things that you'll see on someone's legs that you won't necessarily associate with varicose veins, which can be a real problem. So someone might say that this photo is just spider veins, but this is truly associated with something called small saphenous vein insufficiency, and this person had all kinds of pain and itching in the back of their calf.
Oh. So something like that can be pretty itchy, and you need to have a doctor take a look at it.
Yep. This is something called phlebectatica, which we'll have a few more photos of. People think these are just cosmetic veins as well around the ankle, but these almost always mean that there's something happening under the surface of the skin in terms of varicose veins. Now, someone might say, well, these are just leg rashes.
It looks like bruising.
Yeah, almost. Unfortunately, it doesn't come through quite as well, but that's a lot of brownish discoloration there called hemosiderin, and this condition is actually called lipodermatosclerosis, which is scarring of the skin and the fat due to inflammation from varicose veins. This is also called lipodermatosclerosis with a little bit of stasis dermatitis, which is a skin rash which doesn't go away on the leg and is associated with varicose veins. This is usually itchy and painful.
Looks like a little swollen too, possibly.
Yeah. So here's somebody with typical varicose veins, the big ropey veins, and I see these every day in the office.
When you say varicose veins, I think that's what the average person thinks of right there.
And you can see by the hairy leg, this is on a man. Interestingly, 10% of all men do have varicose veins, and when they do have them, they're usually much worse than they are in women.
Really?
Yeah.
So why are varicose veins important? Why do you need to know what you're dealing with?
Because varicose veins do lead to inflammation of the skin. Inflammation of the skin leads to swelling and ulcerations and scarring and can lead to blood clots. So it's a true medical problem. Varicose veins are a medical condition that is covered by insurance, and I'm asked this all the time. You know, are these veins covered by my insurance? And if they cause symptoms or if they're causing inflammation of the skin with leg rashes, thickening, ulcerations, they always are. They're a real medical problem.
So normally if your insurance covers it, then you just pick up your copay or like you would for any operation at the hospital.
Right, including Medicare. Medicare does cover this.
Okay. So what is the actual cause of varicose veins?
Well, we used to think that varicose veins were just caused by faulty valves. We now know that there's probably a genetic component which leads to an abnormal protein deposition in the vein, which causes it to swell. When it swells, then the valves and veins, which prevent blood from flowing backwards, can't work, and then you have this high pressure system in the veins, which are only used to low pressure, and so fluid leaks out of the veins into the skin, causing inflammation, pain, swelling, itching, etc.
Wow. So if they're not treated, okay, you've had the diagnosis, they've been in, they've seen you, they've been diagnosed. What happens if they have all this information and they don't do anything with it?
Well, they can lead to inflammation of the skin. And so, interestingly, many people who have the worst problems with veins under the surface don't have any veins on the surface of the skin. So just because you don't have those big ropey veins does not mean you don't have a problem with the veins under the surface. And I see this time and time again, that people don't actually suspect that that's what's happening under the surface. So what happens at first is that you develop rashes on the skin called stasis dermatitis, itching, weeping, etc. Then that can progress to lipodermatosclerosis, which is scarring of the skin, thickening of the skin, and that leads to hemosiderin deposition, which leads to brownish discoloration, and that can then eventually lead to ulcerations. Ulcerations on the leg, which can be painful, infected, usually does not lead to loss of a leg or a toe or anything like that, as in diabetes, but can be a real problem. If you get treated, if you get diagnosed and you get treated appropriately, you can stop that process in its tracks and actually reverse it. And you won't have normal skin, but you'll have skin that is much better, much nicer, softer than it was before.
So one of the first stages is actually, you said, weeping skin. So
it can be weeping skin.
Can be oozy a little bit. And
sometimes oozy, sometimes it's just a dry, itchy rash or a patch on the inside of the ankle. Sometimes people all of a sudden wake up with this hard, tender area in their leg, and their doctors might think that it's due to an infection. It's not an infection or cellulitis. It's actually due to varicose veins.
Right. So normally, this could happen fairly quickly in someone?
It can happen quickly. Usually it's a progression over time, over several years.
Over several years.
Yeah.
Normally, but in certain, I'm sure, as with everything, there's, you know, for different people, it happens differently. So we just went through the progression. What are some of the experiences that people have?
Okay, people who have varicose veins typically will have pain, aching, swelling in their legs. What a lot of people don't understand or realize is that varicose veins can actually cause restless leg syndrome, that sensation that your legs have to move at nighttime. It can cause nighttime leg cramps. It can cause daytime leg cramps. In fact, I just treated a woman a couple of months ago. She came back for a follow-up visit, and she said her nighttime leg cramps completely went away, and she thought it was just an aging process. Other things that it can cause, diabetic peripheral neuropathy is frequently associated with varicose veins, and if you treat the varicose veins, you can actually improve the painful tingling sensation of diabetic peripheral neuropathy. I also see people all the time who have weird leg pains. They can't be explained. I had a woman who was told she had bilateral sciatica, or pinched nerves in her back causing pain down her legs. We treated her varicose veins. Her, quote, sciatica went completely away.
So getting back to the diabetes, that can be very bothersome. A lot of times, people with diabetes, if they do have that tingling sensation in their feet, and it feels very warm,
right,
and all that, sometimes there could be an underlying condition of varicose veins with that.
Correct.
So even if you show no symptoms, that might, if you've been told it's not going to get any better, you might want to look into seeing you to see if maybe there is another underlying...
A quick non-invasive ultrasound will help you decide whether or not there's actually a problem going on.
Right, because, I mean, there could be a couple of things going on there at the same time. And now, what can you see on the legs of people with varicose veins?
So we've talked about some of the photos that you've seen. So some of the things that can happen besides just those big ropey veins on the surface or spider veins on the surface, you can actually have swelling, unexplained swelling. You can have leg rashes. Those leg rashes can then progress or be a part of scarring on the skin that I talked about. This is called corona phlebectatica that you're seeing on the screen right now. This is almost always indicative of a problem under the skin. Leg ulcers, especially on the inside of the ankle, 2/3 to 80% of those are caused by varicose veins. This is another example of corona phlebectatica, which is those veins around the ankle, spider veins, that some people think are just cosmetic, but are not cosmetic. This is indicative of something happening under the surface.
See, when you think of varicose veins, we think of that photo that you showed us earlier, the big, thick veins that stick out from your legs. This, though, is actually much deeper.
Yes, this is indicative that something is happening much deeper under the surface. This is called Stasis Dermatitis, which I talked about. This is a rash on the legs. This is a little weepy, and it's itchy, and it can be treated with creams, steroid creams usually. Sometimes doctors will treat it with fungal creams because they don't realize exactly what's happening. And it might get better, and then it's going to get worse, and then it might get better, and then it's going to get worse. This is a pretty extreme case of stasis dermatitis.